In this presentation, we'll delve into the intricate world of mood disorders, which are a challenging and often debilitating category of mental health conditions. These disorders can profoundly affect a person's day-to-day life and overall sense of well-being. We'll take a comprehensive look at the different types of mood disorders, ranging from depression to bipolar disorder, and examine the array of symptoms they encompass. Additionally, we'll explore the latest advancements in treatment strategies aimed at helping individuals manage and overcome these conditions, ultimately aiming to restore emotional stability and enhance quality of life. So let's embark on this journey to gain a deeper understanding of mood disorders and explore effective avenues for support and recovery. Major depressive disorder, or MDD, is a pervasive mental health condition characterized by persistent low mood, loss of interest in one's pleasurable activities, disruptions in sleep and appetite, feelings of guilt and worthlessness, and in severe cases, suicidal thoughts. To meet the diagnostic criteria for MDD, these symptoms must persist for at least 2 weeks, indicating clinical depression. While the exact causes of MDD remain elusive, research suggests a complex interplay of factors including neurotransmitter imbalances, genetic predispositions, and environmental stressors. Treatment for MDD typically involves a multifaceted approach. Psychotherapy, particularly cognitive behavioral therapy, CBT, is commonly used alongside medication management. Selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, are often prescribed to address neurotransmitter imbalances. In cases of severe or treatment-resistant MDD, more advanced interventions like transcranial magnetic stimulation, TMS, or electroconvulsive therapy, ECT, may be considered to provide relief from symptoms and improve overall functioning. A typical depression represents a distinct subtype of major depressive disorder, MDD, characterized by symptoms that deviate from the conventional presentation of depression. Individuals with atypical depression often exhibit increased appetite, weight gain, and hypersomnia, excessive sleeping, alongside the typical symptoms of depression, such as low mood and loss of interest. While the exact etiology of atypical depression remains unclear, research suggests that it may involve a different neurobiological profile compared to typical MDD. This may include dysregulation of inflammatory processes and altered sensitivity to environmental stressors. Treatment for atypical depression typically involves a multifaceted approach. Psychotherapy, such as cognitive behavioral therapy, CBT, is often employed alongside medication management. Antidepressants like fluoxetine, Prozac, and sertraline, Zoloft, are commonly prescribed due to their efficacy in addressing the symptoms associated with this subtype. Persistent depressive disorder, commonly known as dysthymia, presents as a chronic and enduring form of depression characterized by a consistent low-grade depressive mood persisting for at least 2 years. Individuals with persistent depressive disorder may encounter symptoms such as low self-esteem, feelings of hopelessness, and difficulty concentrating. Although these symptoms are pervasive, they are typically less severe compared to those observed in major depressive disorder. The treatment approach for persistent depressive disorder often involves a combination of psychotherapeutic interventions such as cognitive behavioral therapy, CBT, and pharmacological management. Medications commonly utilized include selective serotonin reuptake inhibitors, SSRIs, or serotonin norepinephrine reuptake inhibitors, SNRIs, tailored to alleviate symptoms and enhance overall well-being. Seasonal affective disorder, SAD, is a subtype of depression characterized by recurring episodes that coincide with specific seasons, notably during fall and winter when daylight hours are reduced. Individuals with SAD may manifest symptoms including increased sleep duration, heightened appetite, weight gain, persistent low mood, and diminished energy levels during these seasonal periods. Management of SAD frequently incorporates light therapy, where individuals are exposed to bright artificial light to simulate natural sunlight and regulate circadian rhythms. Additionally, treatment may involve the use of antidepressant medications and psychotherapy to address underlying mood disturbances and enhance coping strategies. Postpartum depression, PPD, is a prevalent mental health condition that emerges in the weeks and months following childbirth, affecting a significant number of new mothers. Unlike the transient baby blues, which typically dissipate within the initial 2 weeks postpartum, PPD persists over an extended period. The impact of PPD extends beyond the individual, significantly influencing family dynamics and the well-being of the entire household. It can hinder the mother's ability to form a bond with her newborn and may also adversely affect the mental health of her partner. Treatment for PPD commonly involves a multifaceted approach encompassing psychotherapy, notably cognitive behavioral therapy, CBT, and pharmacotherapy, typically through the administration of antidepressant medications. Timely intervention and robust support systems are pivotal in fostering recovery and nurturing the emotional health of both the mother and the child. Bereavement stands as the natural and anticipated reaction to the passing of a loved one, encompassing a spectrum of emotions including sadness, introspection, and challenges in managing daily routines. Clinical standards typically delineate normal bereavement to a time frame of approximately 6 months, acknowledging the variances influenced by cultural norms and individual disparities. Ordinarily, bereavement doesn't necessitate formal intervention, given its intrinsic nature as a response to loss. However, if grief persists beyond the expected period or impedes regular activities, seeking professional assistance like grief counseling can offer valuable support and facilitate the healing process. Treatment-resistant depression, TRD, emerges when conventional antidepressant therapies fail to effectively manage symptoms despite at least 2 treatment trials. This daunting reality affects an estimated 35% of individuals grappling with depression. The etiology of TRD remains elusive, but is thought to stem from a complex interplay of genetic predispositions, neurobiological mechanisms, and environmental influences, rendering traditional treatment approaches ineffective. For those contending with TRD, more advanced therapeutic modalities may be explored, including transcranial magnetic stimulation, TMS, electroconvulsive therapy, ECT, or the utilization of emerging medications such as ketamine. These interventions offer renewed hope by targeting treatment-resistant symptoms through innovative means. Bipolar disorder presents a dynamic spectrum of mood disturbances alternating between depressive and manic episodes, each with distinct symptomatology. During depressive phases, individuals endure a myriad of challenges akin to major depressive disorder, including insomnia, anhedonia, feelings of worthlessness, and suicidal ideation, profoundly impacting their emotional landscape. Conversely, manic episodes manifest in heightened states of energy and activity, often marked by agitation, rapid speech, impulsive behaviors, and grandiose delusions, posing significant disruptions to daily functioning. The treatment paradigm for bipolar disorder revolves around a multifaceted approach, integrating mood-stabilizing medications like lithium or anticonvulsants alongside psychotherapeutic interventions. This comprehensive strategy aims to mitigate the frequency and intensity of both depressive and manic episodes, fostering stability and improved quality of life. Cyclothymic disorder presents a chronic pattern of mood instability, oscillating between mild episodes of hypomania and dysthymia without meeting the criteria for full-blown manic or depressive episodes. Key to the diagnosis of cyclothymic disorder is the persistence of these mood fluctuations over an extended period spanning at least 2 years, punctuated by fleeting intervals of stable mood. In managing cyclothymic disorder, psychotherapeutic interventions play a pivotal role, with modalities like cognitive behavioral therapy, CBT, or interpersonal therapy offering strategies to navigate mood swings and enhance overall functioning. Through tailored support, individuals can better understand and cope with the challenges posed by this chronic mood disorder. Antidepressant medications offer a diverse array of options for managing mood disorders, each targeting specific neurotransmitter systems to alleviate symptoms and promote emotional well-being. Selective serotonin reuptake inhibitors, SSRIs, including fluoxetine, Prozac, sertraline, Zoloft, and paroxetine, Paxil, function by enhancing serotonin levels in the brain. Widely prescribed, they effectively address depression and anxiety disorders by modulating serotonin neurotransmission. Serotonin norepinephrine reuptake inhibitors, SNRIs, exemplified by venlafaxine, Effexor, and duloxetine, Cymbalta, augment both serotonin and norepinephrine activity. This dual mechanism makes them suitable for treating depression and certain chronic pain syndromes. Monoamine oxidase inhibitors, MAOIs, such as phenelzine and tranylcypromine, exert their antidepressant effects by inhibiting monoamine oxidase, an enzyme responsible for the breakdown of serotonin, norepinephrine, and dopamine. While effective for atypical depression, their use is restricted due to potential interactions and side effects, relegating them to second-line treatment options. Mood stabilizers are pivotal in managing bipolar disorder, aiming to balance mood fluctuations and minimize the risk of manic and depressive episodes. Lithium, a long-standing cornerstone in treatment, operates by stabilizing mood dynamics. Regular monitoring of lithium levels is imperative due to its narrow therapeutic window and potential adverse effects. Anticonvulsant medications, such as carbamazepine, valproate, and lamotrigine, serve as effective alternatives, modulating neurotransmitter activity to stabilize mood swings characteristic of bipolar disorder. Certain atypical antipsychotics, like olanzapine and quetiapine, have garnered approval for treating bipolar disorder either alone or in combination with other mood stabilizers. Their efficacy extends to managing both manic and depressive episodes, offering additional therapeutic options for individuals with this complex condition. Addressing enuresis or bedwetting typically commences with conservative strategies like employing bedwetting alarms, establishing voiding schedules, and minimizing caffeine intake. Should conservative methods fall short, medication options come into consideration. Desmopressin, DDAVP, and the tricyclic antidepressant imipramine stand out as potential remedies, aiding in nighttime urine reduction and bolstering bladder control. Crucially, delving into potential underlying medical or psychological contributors to bedwetting is paramount. By identifying and addressing these factors, clinicians can tailor treatment strategies effectively, enhancing the likelihood of successful management.